Hello, my name is Kimberly Yanga, your CEO here at ABC Medical Center. I'm here to talk to you about some exciting addition to our organization. We have decided to adopt the electronic health record system, which will help us with providing better quality care for our patients and at the same time, better reimbursement and more compliant to government regulations. The first component of EHR is the administrative component. This will be very helpful for us regarding scheduling. It will be easier to schedule patient appointments for surgeries, visits with their doctors, or any lab work or imaging appointments. And then another thing is the finance department could use this also. It would be better for billing. We won't miss any more billing or codes for submit when we're submitting for reimbursement would be more accurate with this system. And then another component of EHR is the communication and connectivity. This will be very helpful for us communicating with our patients. Providers could communicate with patients, and also like each department, the communication will be much better. There will be emails, you can communicate through emails, or also there's going to be telemedicine, telehealth. Patient can do like video conferencing visits with their provider. So this one would be very helpful for us. Another thing is the health information and data. Every time a patient visits, the notes of the provider is already there so that the next time, they come back, the provider can see if there's any changes in the health condition of the patient. It would help them um, decide better regarding how to care for the patient. It's like a better help with their decision making regarding the patient's health and treatment. Another one's order entry management. No longer we have to write our orders. Providers could just enter it in the computer, and once it's entered, anyone can see the order right there. Another safety feature is that when a provider opens up a patient's chart and they want to order medication, there would be like references. If let's say a medication is contraindicated with another medication or this patient's condition, it will give the provider an alert or a reminder that hold on, this patient has this, you cannot order that medication. So in a way, this one provides safety in delivering care to our patients. The main concern here with the EHR is providing patient care, because the patient with this new system will be more involved with their care. They will be engaged in their care. They're empowered to make decisions regarding their care. They're not going to be just passive consumers. They'll be active in decision making regarding their health. So there's like a lot of things that are now being used with this technology. There's the virtual community. If you notice, like there's like in the computer, especially now we use a lot of social media. When we deliver health, we can deliver health and education and provide support through virtual community. Usually these ones are like are these ones are being proctored by health organizations. They provide support for like people with like the same illnesses and stuff. They provide some collaboration. They share their experiences regarding their illness. So it's like an emotional support group at the same time, but also they're giving information to each other. Another one is social media is really used nowadays in healthcare. Like each organization, if you'll see, they have it on Indeed or in Facebook, Instagram, all these social media they're using this now to reach their patients or the public. They use it for advertising. They use it to reach their consumers, the patients, to advertise what the hospital can provide. So we will be doing that too. Also, social media is now being used for training. If you'll see, like, when they provide hashtags for like this training session, they're encouraged to use hashtags, and then there's like a place for the trainees to ask questions to the trainer, and it gives the trainer the opportunity to answer any questions that the trainee might have. Another thing is like when they're sharing information in social media. um, well, with this one, it's kind of, um, we have to watch out also for HIPAA, make sure that we're in compliance. So we cannot really specifically or precisely say anything about the patient, but just as a general, we can provide information regarding like with the pandemic or with any outbreaks out there. Then we can share information on how to avoid, let's say, flu, like announce that it's time for flu vaccine, benefits of having flu vaccine, also for like smoking cessation. It's just like general information that we can share to the public, that would help them take better care of themselves. Another one is PHR. You'll hear about PHR. It is personal health record. This is a collection of data. So when you go to your doctor for a visit, all the data that you give, your vitals, everything, your lab result, is all in one record. It's kept on the personal health record. These allow the patients to have access to their health condition. Usually this one would be like for like they'll have a portal that they could access their lab results, their medication list, um, everything that they need to have knowledge of what's going on with their health. This is a part of the EHR, or the electronic health record system. The benefits of PHR is that it helps patients take better management of their care. Um, let's say with it has their immunization records, like I said, the lab results, screening, screening for scheduling dates for their future appointments and stuff. This one would be very helpful for them. It's a reminder, and then they could see like all their lab results. And what happens is that with this patient being able to access their health, the lab results and everything, over time, what it is they get more involved. They see a trend. Okay, if like they're doing better when they're doing this, are the results much better? Or if not, then what happens is that when they see this trend over time, they get to be more engaged with their own health care. And then another advantage of PHR is that patients can access this 24/7. The portal is there. They make their own username and password for a portal for our organization. And then they could access it anytime 24/7. And this is really good when people travel. Some people travel a lot. And you never know what's going to happen when you travel. With this, you have an access to your records. So if a doctor there needs to see, okay, what was your lab the last time you went there, so that they could better manage their care at that time, or decide on how they would approach taking care of this patient, um, they could easily access the portal and give that information to the doctor that's caring for them while they're away from home. Um, Another advantage is that patients, since they see the results and also the information that's being said about their health, could actually verify if this information are accurate or not. So it's a very good thing, I think. this one is really going to help us provide better care for our patients. You'll also hear about M Health or mobile health. Mobile health is another thing that is a part of this new technology where the use of like phones, smartphones, tablets, in actually monitoring a patient's care. What it is that, this blood pressure cuffs now, like when they check blood pressure monitoring, glucose monitoring. If you notice, all the stuff that's coming out now, the equipments for those are actually linked to like this system where it could be sent to your doctor. Say you check your blood sugar right now and it was high. This is linked to a system where they would contact you if everything's okay because your blood sugar is out of range. And then another thing is if you need to send that to your doctor, you could just hit a button and then it would fax it to your doctor. So all these amazing things are I'm really looking forward to it, for us to use this. I think it would be a really great addition for our organization. It would help us provide better care for our patient. We can um, also get better reimbursement, and at the same time will be in compliance with the government's regulations. So I'm looking forward to it. I hope you are too. And this will be a great addition for us, and I hope everything will be happy. And I really want to thank you for all the hard work that you do, and thanks for your cooperation. You have a great day. Thank you. Bye bye.